The Local Outcome Improvement Plan, or LOIP for short, aims to make Aberdeen City a place where all people can thrive regardless of background or circumstance. Unfortunately, today in 2026, some people's quality of life is still determined by childhood poverty, the neighbourhood they live in, and their ability to access support. Over the next 10 years, the Local Outcome Improvement Plan will deliver 5 changes to make sure that people and communities who need additional resources and support get the help they need to thrive. At the same time, everyone will continue to have access to regular services like education, healthcare and policing that are already provided in the city, making Aberdeen a healthier and fairer place for all of us to live in. So, what changes can you expect to see? What will Aberdeen be like in 2036?
Young people from wealthier parts of the city are more likely to finish school and go to university or into training or work. Too many children from poorer areas, through no fault of their own, can't access the opportunities and experiences they need to build successful lives. Young people who have experienced trauma in early life are at greater risk of disengaging from school and require extra support to prevent lifelong disadvantage.
When I'm listened to, things feel different. It makes me feel like I matter. I know what helps me feel safe and what doesn't. Sometimes I don't always feel safe, and that's hard. But if I could be involved in designing safe spaces, they'd feel different, more comfortable, more supported, like I belong.
The Local Outcome Improvement Plan will involve more young people in designing unsafe spaces and informing and receiving the personalized support that they need to prevent harm. More vulnerable young people will be in work, training or education after school.
1 in 7 households has nobody in employment, and too many children live in low-income households. Employment rates for ethnic minority residents are below the city average. Young people and those without qualifications face barriers to work, as do single parents. At the same time, 10% of employees earn less than the living wage, meaning work does not always protect people from poverty.
I faced significant challenges securing employment in my field. As time passed, I felt increasingly overlooked. My confidence began to decline. At times, struggled with feelings of self-doubt and worthlessness.
People have so much untapped potential. Their life skills and experience should be valued. The Local Outcome Improvement Plan will provide more skills development opportunities in high-demand employment areas. It will become easier for people to find jobs which offer fairer working conditions. This means that in Aberdeen, by 2036, working lives and wages in the city will be fairer, and employment gaps between disadvantaged groups and the city average will be narrowed.
Today in Aberdeen, many people are facing significant challenges with growing pressures around the cost of living. Rising costs, insecure incomes and inefficient housing have left 18% of the population in relative poverty, with thousands of children growing up in low-income households. Lone parents, larger families, those with very young children, younger mothers, families affected by disability and minority ethnic communities face the greatest vulnerability to child poverty. Support systems, though well-intentioned, are not always joined up and are reactive, leaving gaps that perpetuate hardship and increase the risk of homelessness.
Getting the support in the city can feel quite a tedious process, having to contact multiple people, and it can be really time-consuming. Services are needed in one place.
The Local Outcome Improvement Plan will make sure more people receive the right support in the right place and at the right time.
Hi, welcome to the Hub. It's nice to see you. How can I help you today?
Reducing the risk of poverty and homelessness. People will be able to access all of the help they need, from financial, housing and food to health and employability and family support at the same time. Vulnerable families will receive support from the same person, and preventable harms such as mental well-being, domestic violence and substance use will reduce. more people living in Aberdeen City will have been lifted out of poverty and fewer people will be at risk of homelessness.
Too many communities in Aberdeen, particularly people with the highest levels of need living in our most deprived areas, continue to feel that they don't have influence in things that matter in their neighbourhood. Access to green spaces and nature-based activities improves mental well-being, reduces social isolation, and strengthens community cohesion. However, access is unequal across the city, and people in the most deprived neighbourhoods experience more barriers to making use of it. Climate and energy challenges intensify these inequalities.
Mount Holy Food Forest is a green space for the community to visit, interact with, and enjoy, started by a group of residents coming together to create an oasis of peace. The group has made the decisions on how the forest will develop over the coming years.
Focusing on deprived neighbourhoods, the local outcome improvement plan will make it easier for people to have a say about their neighbourhood, shaping their environment. People will be more connected, have greater influence over their communities, and live in a healthier, greener, and more sustainable city.
Healthy life expectancy is declining, and people in deprived communities not only live shorter lives, but spend more years in poor health. Too many people in Aberdeen are experiencing harms, and preventable deaths relating to substance use, gambling, and mental health are rising. People feel unable to ask for help and fear judgment and stigmatization. It is also difficult to understand how to access the right support at the right time.
I'm a person in recovery. I'm also a mother, a wife and a grandmother. Going in and tell your story to this service and then go back in another service and tell your story again. And it's just raking up stuff for you constantly, so you're re-traumatised all the time. Having a one-stop shop where everybody and people talk to each other would make things so much easier for people going forward.
The local outcome improvement plan will provide new recovery options to help reduce stigma and isolation for people with complex needs over time, providing the support that meets their individual needs, and this being coordinated for them will avoid people having to repeat their stories and help people stay engaged. People's lives in Aberdeen City will be healthier and happier for longer. The gap in preventable deaths between neighbourhoods has been reduced.
We think a decent quality of life should be the reality and not a dream, achievable for everyone in Aberdeen by 2036. Aberdeen's local outcome improvement plan is working to make this happen.